Hello everybody, today the online lesson is about a practical tip of managing patients with wrist pain. If patients come to you with unknown wrist pain and consult you, first make sure if there is no neovascular involvement and no surgical management is involved, no matter it's suspected unstable fracture, ruptured tendon, or of course post-surgical management. You can simply prescribe wrist immobilization for 4 to 8 weeks to the patients. So in this way, there are up to 60% chance you can cure the acute wrist pain for this patient. I'm going to tell you why. So first, let me elaborate a little bit more. One of the prerequisites is that there is no neovascular involvement. For example, like neck referral pain, carpal tunnel syndrome, thoracic outlet syndrome, that is not suitable for this tip. Okay, so make sure there is no pins and needle, numbness, unexpected weakness of the muscle. Let's screen it out. No surgical involvement, that means there is no unstable fracture, there is no tendon rupture. You can easily tell by a history of trauma and significant decrease in function, so that you can suspect there is unstable fracture or tendon rupture. Just send them off. So why in this case we can just simply prescribe the wrist immobilization for patients? Remember the clinical patterns in the wrist joint? We have inferior radial outlet joint sprain. We can have carpal joint sprain. We can have TFCC injury. We can have collateral ligament sprain or overuse. Scapular fracture, assume it is a stable one. So, do you remember what are the treatment principles for those conditions? They are immobilization, 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 and of course, after the immobilization period, the patient will present stiffness, tightness, and weakness. We need to do the rehabilitation, but not the other way around. Immobilization should come first. Wrist joint is a very complex structure and it has lots of mobility. Therefore, a lot of injury, the stability structures are more likely to suffer. So in this way, we need to provide an optimum environment for the stability structure to heal. That's why we need to immobilize it. Of course, a good clinical reasoning can increase the chance of helping patients to get rid of the pain. But just in this special region, the wrist joint, we can use these practical tips if you are relatively junior. That really helps. So that's all for today. Thank you.